My name's Janae and I live in Stafford, Virginia. I have a history of fibroid tumors in my uterus, and we did a procedure several years ago to remove them, and that was successful, but they kept growing back, and they are very painful, and your monthly cycles are very uncomfortable, and they last longer. So it comes to a period in your life where you're just ready to not have that kind of discomfort anymore and have some freedom. So I was very happy when they recommended that I have it done. And even happier that it could be same day and less invasive.
In the last 3 years, 100% of all our surgeries have been minimally invasive here at Stafford Hospital. That puts us at the top 1% of pretty much any GYN surgical program in the country. Some of the surgeries that we perform are total laparoscopic hysterectomies, laparoscopic myomectomies, laparoscopic tubal reversals, laparoscopic sacrocolpopexies. As far as laparoscopic hysterectomies are concerned, we brought laparoscopic hysterectomies to this region. We continue to grow that service line for patients in this region. Over the years, we learned that laparoscopic surgery is the preferred method for doing minimally invasive surgery. It gives patients quicker recovery time. It gives patients less pain, back to work sooner. It's usually about 3 incisions, a belly button incision, which the patient will never see again, and 2 lateral incisions, which are about 5 millimeters in length. So very small incisions. Usually most patients don't even recognize these incisions. 10 weeks later, they never even see them again.
I have 3 children and all were delivered by cesarean section. So to me, that was just the normal way to be able to get to your female parts. So to be able to have a less invasive surgery was just a gift to me, because I know what the recovery of a C-section is. And so this recovery was much, much less and pretty amazing.
For a laparotomy or an open abdominal hysterectomy, usually the hospital stays can be anywhere from 3 to 4 days. For a laparoscopic hysterectomy, patients are going home either the same day or the next morning. Patients do great. I always tell patients the first week you're always going to feel like you had surgery. By the end of the second week, you're about 90% of where you were preoperatively. At the 3-week mark, you probably at this point has already forgotten that you had surgery.
Prior to the procedure, 2 weeks out of every month, I was not a happy camper. Some days just trapped to the house, and now I don't have to worry about that. My quality of life has changed on a monthly basis.
Most patients have this impression that these type of surgeries can only be done at large medical centers. In fact, we're doing world-class surgery here at Stafford
Hospital. It's wonderful for our community, truly.